My name is Jamie Demore. I am the Executive Director of the Canadian Primary Care Research Network, or the CPCRN. Thank you for joining us for today's learning series session entitled Indigenous Health Data Governance Toolkit. So I'm really excited to have Kimberly Fairman with us today and Shanil Pathak. Uh, we Kimberly Fairman is one of the co-principal investigators of the CPCRN. She is the director of the Northern Practice-Based Research and Learning Network. She's also the lead of the Indigenous Health Pillar of Research of the network. And we have Shanil with us, who is also very involved in our network with the Canadian Primary Care Research Network Patient Council. And he is also very, very involved with this space in terms of data sovereignty and data. He is an advocate for data sovereignty as well, and he will, I'm sure, get into this. So without further ado, and first I'm just going to begin with a land acknowledgement, of course. So the CPCRN acknowledges the contributions that the First Nations, Inuit, and Métis peoples have made for advancements in what we now call Canada. We respect the treaties that were made on these territories and lands. We acknowledge the harms of the past and present, and we dedicate ourselves to work with and listen to First Nations, Inuit, and Métis communities in the spirit of reconciliation and partnership. I myself am calling in from Montreal, or Tiohtià:ke, and it's the unceded territories of the Kanien'kehá:ka peoples. So without further ado, I will introduce Kimberly Fairman to begin the session today. The session will be about 30 minutes, and then we have a question and answer section, which will also be about 30 minutes as well. If it does get, if the presentation isn't as long, we will just have more time for a fruitful discussion. So over to you, Kimberly.
Great, thanks, Jamie. I'm actually really looking forward to this webinar, mostly because I did recognize some names of the people who signed up and who may be there. I can't see anybody right now, but if there are people that I know from the network, good morning or good afternoon where you are. I'm really pleased to be here, and I'm looking forward to the exchange and sharing some points that I have around data sovereignty or data governance. And then Shanil, my partner panelist here, is going to jump in and we'll sort of co-present, if you will, with a few slides that I had prepared. So I'm just going to start sharing my screen, and I'm going to do the presentation. Okay, so I'm assuming everybody can see my slides. Okay, good. And just so you know, this morning I am calling in from Cambridge Bay in Nunavut, which is the region of Nunavut that I'm from, the Kitikmeot region, and the community that I'm from is Toolkit, which is just a little bit further east of here. So really the objectives today for the webinar, we're hoping that through this presentation, there would be an increased understanding of the importance of data sovereignty. And really, from my perspective, that's about supporting Northern Indigenous communities to build capacity and advance their own work in health and wellness data collection, the use and management of that data. And I really hope that we together can gain a broader understanding of why it's important to support the integration of Indigenous knowledge into approaches for collecting data and managing data. Sorry, I'm just going to close this door here too. I think it would be that noisy. Go. And then also, I wanted to take a few moments to help people get a little bit more familiar with the toolkit that we developed. I think it was a year and a half ago through the CPCRN that really was a toolkit designed for communities to start to think about their involvement in health data collection and management and governance, and some of the reasons behind that. So this is me, and the pictures in here are all pictures that I've taken from my visits in my home community, and then also this one is actually from Cambridge Bay earlier this year. I was here in June, and so this is sort of the landscape that I'm on, and then recognizing that Nunavut is an area that also has land claim and self-government agreements in place, like modern treaties. I work as the executive director at the Institute for Circumpolar Health Research, and that institute is really also focused on conducting and facilitating ethical research in community, and really thinking about how to improve the health and wellness and reduce the human health disparities that exist in the North, and for Northern residents and for Indigenous residents in particular. And so a lot of the work that we do is around community-based research method, but also, training and educating Northern stakeholders and also our research partners on those health research methodologies that are inclusive. And Chanel, I don't know if you want to take a moment to introduce yourself and your background as well.
Yeah, thank you, Kimberly. I've been a patient advocate for a number of years. It's coming from lived experience, and professionally, my background is in data analytics and big data. And from my own personal experience, I saw the empowerment of individuals having their own data. And you see this with people who are engaged in their health or have chronic disease or cancer, that they walk around with these binders. It's they're trying to collect all their information because it's an empowerment. And that's what I advocate for, is that there's so much fragmentation that honestly, you are really the glue to connect all these disparate systems of health data. And I advocate for data sovereignty in the sense that you should have access to your whole health information, not just in the EMR, but everything that could carry with you for life, no matter where you are. And then therefore, it'll help you, it'll help your family, and also possibly help your descendants, depending on the health challenges you have. And so that, in essence, is a way of, I think we all could contribute to healing our healthcare system, and this is one contribution we all could do, is be more informed in our health, and that may help practitioners to help you.
Mm-hmm. Great, yes. And so that's where I always like to start out, is talking about relationship. And from an Indigenous perspective, there are a number of guiding documents. There are legislative components that we have adopted. So, thinking about the Truth and Reconciliation Commission, UNDRIP, and also I think it's important to, as we do land acknowledgements and we talk about these things, to understand sort of these modern treaties that we call comprehensive land claim agreements that often include self-government components, right? And in some cases, that includes the transfer of responsibility for health or social programming. And I just mentioned that, if people have an interest, I think it's a really important place to sort of understand the landscape from an Indigenous perspective, is some of these framing documents where, we think about, and I want to recognize the fact that First Nations and Inuit and Métis people have sovereign rights. And really, these agreements recognize their authority to own and govern their data. Doesn't matter where the data is housed, but that is fundamentally what that right is. And then, you know, any organization or researcher or network that is thinking about or looking to collect and report on Indigenous health and well-being should be thinking about these contexts, right? And I think from there, where we're headed or what we want to accomplish is meaningful partnerships with community and relationship. So we start with meaningful engagement with the communities that we're working with. So First Nations, Métis and Inuit people, their governments, or the organizations that we are hoping to partner in research. And to me, that engagement, the focus of it should always be on building strong and sustainable relationships first. If research and data collection eventually comes out of that strong relationship, I think that's a win. But really, in the beginning, to me, focusing on the relationship, you know, thinking about respect, open communication, ways to build trust, right? That's the focus in this relationship period. And I think I'll stop there and maybe see, Chanel, if you want to jump in with some thoughts around relationship or the focus on relationship.
Mm-hmm. I think with relationships, to be frank, I felt that our healthcare system is quite paternalistic, and we see a shift happening throughout Canada, where empowerment, I mean, data equals empowerment, and there's a visibility on that. And I think the work that Kimberly and what we're doing at the Institute in the North is pioneering and applicable to everyone across Canada. This is about part of that relationship is about trust, and then also about agency, and data is a vehicle for both of that. Mm-hmm.
Great. Yeah. And just from that, you know, what we're talking about is co-development of data governance protocols. You know, anytime that we're collecting, accessing or using data, and we're also talking about it through the data lifecycle, right? So the responsibility really is with every facility, every organization. If we're talking about regional health, you know, authorities or provincial or territorial governments, that responsibility for co-development is, you know, rests with those organizations. So really thinking about how to be respectful in the approach to data governance, and again, using that engagement piece. So, you know, thinking about rights, but also, you know, as Chanel is pointing out, it about the partnership that should exist in these organizations between individuals and then at a higher level in the organizations. So another goal of the toolkit and the work that we do at ICHR as well is closely linked, is really around capacity building. You know, a lot of the discussion around data governance is focused specifically on data issues, where I think we should be thinking about the broader context and the overall principles or values that underlie the systems, you know, as Chanel was saying. And then often we think about rural and remote or even patient partners. In the healthcare system, we often use a deficit model, which I don't think is helpful. And there is a lack of depth to the health model, that it's not based on partnership, it's based on power resting in one place.
Yeah. I think I'm going to echo that, Kimberly, that um, I think in our society today, data is power, and who accesses it and is a custodian has a lot of power. And I think part of patient-oriented research, as well as capacity building, it's about um, democratizing that power by in the using data as a vehicle to move that to individuals. And I think it could help health research because if we do a research from let's say a bottom-up approach rather than a bottom-up approach from as a hybrid of collaboration, you may discover questions to research that may not have been discovered if in the classic sense of coming up with a hypothesis from a person of a research background and then applying it and validating with data, versus let's flip the model and say, well, let's see what people are collecting, give them the data, let's see what they're collecting, and also from an observational standpoint, and then coming out with the questions to research. So I look at it, it's part of the future where people will have their own data, and it's getting cheaper to collect your own data, store it, and there's a lot of technology that's coming out. And then the question then is that, well, we would like to offer that to researchers to be better informed. And I think the end result is advanced research in Canada.
Mm-hmm. Yeah, I agree. And I think when I think about capacity building and where we are headed, like it really needs to be patient partners, or from what the Indigenous lens, it has to be communities that are leading, and that we offer training that is self-determined by those communities, whether it's patient communities or again Indigenous communities. And then the other piece that I think is hugely important is that we think about how to increase capacity in health research to be able to partner with patients and communities. Often we think that, oops, sorry, my computer is kicking me out of Zoom here.
Well, we could hear you and we could see the screen still. Yeah.
Okay, you can. Okay. Yeah. So I won't stop, but I think building capacity in our own organizations to really partner with communities is an important piece. It does take more time. It often takes more resources, but we need to increase capacity as researchers and in research organizations to do that work. I think it also is really important when organizations are in a trust relationship with patient partners or Indigenous communities to really understand what holding information in trust means. It doesn't mean that you get to make all the decisions about how that information is used. It means that you really look to hold the information and use the information to benefit, the people that you're holding it in trust for. And so what does that look like when we think about some of the privacy legislation and those components that sort of govern the way that we use data now.
Mm-hmm.
And I think the only other point on this capacity building piece, and in our research organizations as well as government or health organizations, is bridging, a little bit so that Indigenous communities, between those organizations and Indigenous communities, as well as trying to increase awareness among decision makers regarding the importance of Indigenous knowledge in the generation of evidence and health research.
Mm-hmm. Well, one thing I want to mention, Kimberly, is what I find a lot of policy is made up of from administration data, administration health data, and including health research. And one thing which you can't get in the health system that easily is social determinants of health data. What is happening in the community? And that's another example of, by collaborating with individuals and also community members, is to identify that. We know from my own, the work I do in Toronto, we're with some epidemiologists. They look at, let's say, postal codes, and based on a postal code, they'll determine not only a policy or predictive analysis, but we know that, within a postal code, you could have a variety of social determinants or even social economic um, um, status. And so with technology and phones, you could go down to the individual level and be more accurate, which then may help health research. This all is a completely different field from 20 years ago, where it's really centered on the health researcher. The data that people are looking for often is in the community, or with the individual, in order to make more informed and effective decisions. And I just wanted to highlight that part of the capacity building, I believe, is also identifying and being able to, with consent, collect social determinants of health.
Yeah, good point. So, oops. Did I advance the slide there?
No, it still says capacity building.
Okay, I'm having some technical issue here with my. I'm just gonna have to, I might have to start over here. It says my sharing is paused.
I wonder if you could close and just sharing, then reshare.
Yeah, maybe I'll try that. There we go. Okay. So all the stuff that we've been talking about is sort of taking us in the direction of partnerships. So, we've sort of talked about the current context and where there might be not this sort of partnership mindset in any of the areas of health service delivery or health-focused research. And I think the point that I would make here is that that limits our ability to truly meet the potential, from a partnership model. And so in terms of data governance, I think it's, again, going back to this idea of co-development of protocols for the collection and management and access and use of data through the data lifecycle, but you're really thinking about that trust relationship again. And, a partnership, in my mind, is one where the trust is deep enough that people can actually have honest and open discussion about what's missing, what their expectations were, what were their patient priorities, in terms of wellness. Are we collecting the right information to be able to answer those questions? Moving away from maybe an efficiency model and more towards a client-centered model. It's not easy work, right? These are things where you have to be committed to a partnership and to really, in order for both parties, whether it's at an individual, organizational, or regional and national level, they have to come to the table as equal partners, right? And so where is there inequity in terms of access to information, or where is there inequity in terms of the governance models, right? And to start to invest in making sure that, again, both partners are coming to the table as equals. I don't know if you want to add anything there, Chanel, or?
No, I think the key word is equals. And I think that summarizes the slide.
Yeah. And I hope that through the chat and the dialogue, we get into this a little bit more, because I know, like, when I think about some of the guiding documents, or even when we point towards partnership as a goal, right, in research, it's not practical, right? It doesn't really help people understand how to get through moments of tension or disagreement or things like that about what the goals are. But I really would encourage people also to, is try to spend time in community, or, develop relationship again outside of the goals of data governance, because it's only there that you start to get a sense of how the perspectives might differ, and develop a commitment to relationships sort of beyond the working goal, but really from a human perspective. And it's there that we're going to find that we can create flexibility in our organizations and be a bit more responsive to patient expectations around data governance. And certainly in the Indigenous community, this idea of empowering, and in the goal of the toolkit, which I'll talk about next, is about, really supporting Indigenous leadership and community to start having conversations in the area of health data governance, and for them to going back to Chanel's earlier point about democratizing the data landscape, it's really about how do they want to be involved in the governance, the collection and use of Indigenous health data, and also for communities to start developing and using their own health data, right? So, again, this idea that we may not be collecting the right information from a community perspective on wellness might include other data points or other areas that they think it's important to be developing health data. And then I think it's the toolkit was also meant to try to recognize that there are unique considerations in the North, and that there is when I think about my involvement in CIPSN nationally, there is a real disparity in the capacity around data collection and use across the communities in the North. We wanted the toolkit to not just, be sort of one-sided, but to also support territorial governments and the health authorities, health researchers who are working in the North, to generate a shared understanding about an ethical way to collect and use Indigenous health data. And we wanted to highlight the values and principles of Northern Indigenous cultures and those traditions, and try to provide leadership, in the data governance world around how these values and principles can be used in health data governance to reach to address the realities in the communities, but to reach the goals and priorities of our Northern Indigenous communities. I had a couple more points, but Chanel, I don't know if you want to respond to that.
I haven't looked at the Q&A questions yet, but I think one thing I wanted to mention is I think with the toolkit and also data sovereignty. Data sovereignty is one method to reduce tokenism, and I say that not to be cynical, but I think if you look at it, like Kimberly, you touched on a point about the data and being able to be used for different purposes, and I think if you look at it pragmatically, a lot of times you collect data and it's stored on probably REDCap at some institution at one institution, and it cannot be reutilized, even though it could be reframed and analyzed for different purposes. But there's friction there. And I think part of that data sovereignty is this richness of data could be used for its primary purpose for that research protocol, but then also the utility could be used for a variety of reasons, and then you build on that for longitudinal data, which could help different researchers. The technology often we have today is that it's siloed in an institution used for clinical research, and then it sits there. And it's because of privacy, it's very difficult to exchange. But this is why I advocate, if the individual owns all the data, they could then consent, and that solves the privacy issue that often these pockets of data is unutilized because of that challenge. And so I think that data sovereignty could not only help the researchers, but help the community, help the individual. And that's why I advocate the democratization of data, which I think is in line with the toolkit, and also the philosophy which we've been speaking here.
Mm-hmm. Mm-hmm. Yeah, and that fits with my last couple of points, just on, moving forward, what do we need to do? I think that the toolkit and then this broader discussion about data sovereignty could really be supportive of Northern Indigenous communities to build capacity and really be able to advance their own work in health and wellness data collection and use and management, as well as health research. And I think the other piece that to me, through my work, more and more becomes an issue, is this idea of the integration of traditional knowledge as part of that, the data collection and the use and the data management. Because in my mind, that strengthening of Indigenous knowledge as a component of health and wellness is key. And I think the other piece, and partly what I'm picking up on in some of your comments, Chanel, is that really, as Indigenous people, we are also responsible for our health data, and that needs to be part of that conversation and the capacity building as well, is how are individuals or communities or organizations responsible, truly responsible for their data.
Mm-hmm. It's a good point. Yeah.
Yeah. So that's, I also was just going to quickly go through, some of the areas that the Pathway for Community Dialogue on Indigenous Health Data Governance toolkit covers. And it's really about, it's a comprehensive guide that talks about what health data is, the types of health data that are available, what are some of the data collection methods, and who's who in the health data world. And it's not comprehensive, but it does give people and Indigenous communities a starting point for some of those important pieces. We also walk through the benefits and the barriers to data utilization. We start to talk a little bit about health data governance and what the key components of that are. We spend a fair amount of time encouraging communities to develop a community vision, so a process for thinking about how they want to be involved in research, what their health data needs might be, and what are the values that the community has around the use of health data. And then this very important piece about developing their own indicators for wellness. And then we also have a section on how to build partnerships in health data that are respectful and meaningful. And then we give a couple of examples in the health data toolkit around some models that are promising. There's just a few examples in there. And if people do get a chance to have a look at the toolkit, I'd be really, open and happy to receive comments on the content and where we can develop it further. So I'm going to stop sharing my screen. That's the end of my presentation, and then we can see if there are any questions or comments at this point.
Thanks, Kimberly and Chanel. Yeah, so the next section of this webinar will be I will moderate the questions that are typed into the Q&A section. I was thinking that we could kind of compartmentalize a bit and sort of type in some ideas and comments into the chat, and the questions that you would like the panelists to answer could be typed into the Q&A section. So, please, type away. So I have a question actually, I remember in terms of uh, co-developing this session, I knew one of the goals was to really, how do we better embed this great toolkit into our network? And also, how do we really share this as widely as possible across our network to ensure that people can, again, utilize it with the right people, the right place at the right time. And also, how is there, as just another follow-up question, in terms of the indicators of success in this space, I do believe after reviewing it that there were some indicators that could be, that we could gather information to really ensure and to demonstrate the success. So I guess those are the two questions for the panelists, if you had some ideas, and also really for the participants on the webinar as well. Please type in some ideas that you might have into the chat. So one, how do we embed this toolkit, better embed this into our network and across the country? And how do we, and if you could elaborate a bit more about the indicators to measure success.
Mm-hmm. Do you want me to start, Chanel? Maybe I can.
Okay, yeah.
One of the things that I think about with the toolkit and, my own experience with involving community in health research is that it only becomes useful when you see a need for it. And the only way that you will see a need is if you've established relationships where this conversation comes up, or where there is a level of trust that's been built up, where there is some exploration about how you can work together, what are the priorities. For example, the toolkit has been, like I said, I think it's been out for about a year. Is it? Maybe just over a year. And I've been working in the Northwest Territories to contact, First Nations groups that I'm aware may be interested and that sort of thing. And I have much more success introducing the toolkit and talking about it with organizations that I've already established a relationship with. So, for example, if I send an email out and I'm sort of saying, look, there's this toolkit, it'd be great to talk to you about it. The rate of response that I get is a lot lower than when I've already established a relationship based on, previous interactions, a trust and an understanding of the work that I do and how I do my work. And so I know it sounds I guess my point is that relationship piece is really key when you're trying to introduce a new way to do things, or when you're trying to help people understand that they do have a role in something like health data governance, right? To most people, they think, well, I don't know anything about that. Why would I, get involved? And I don't know, Chanel, if you have the same kind of experience with that.
Yeah, I think actually I was just at a conference, the Canadian Clinical Trials Conference 2 weeks ago. two things they said. One is that they introduced a new framework for decentralized clinical trials. And so on a side note, I think this toolkit would be excellent to be part of that framework. And the second thing which was highlighted is Canada's performance on clinical research. We only have 1 to 3%, I believe. I think this is a general statement. 1 to 3% participate in clinical studies, clinical research. UK is 14%. What that does is that in Canada as a country versus, let's say, UK, when it comes to World Health Policy, they're going to lean towards UK just based on the data and the publications. And so if you look at a macro level, this toolkit and also engagement from the individual, it's a win-win at the individual level, but also at the national level as well. And so I think one angle is, well, how do for the stakeholders which are looking at that big picture is how do you motivate them? And some of these stats are a way to motivate is that this toolkit will engage communities. We already want to push to decentralized clinical trials, which I think is very ideal for the North, just in inherent geography. And then that will ensue better research, more traction, which has a national effect.
Mm-hmm. Yeah, I don't know if that gets to sort of the root of your question, Jamie.
Yes, in terms of how to embed it, that's interesting. And just, I guess we can see from the crowd if there are other questions. I don't see any questions typed in there. In terms of the indicators, I don't know if you're able to share a bit more about them, Kimberly or Shanil, just to give while we wait for people to type in some questions.
Yeah. I'll lead on Kimberly on the indicators from the toolkit. Yeah.
Yeah, and you're talking about indicators of good health data governance.
That's right, because I believe that was, if I'm not mistaken, I believe that the toolkit has several indicators in there to measure success within the data governance and data sovereignty space.
Yeah. Well, I think they call it the key components or something like that. And yeah, I can touch on a couple of those. I'm just going to go to that section of the document. And I guess like when I look at this thing, I do think, some of the things that they talk about in terms of like good health data governance, it's really key to think about sort of as the end goal. And I think what you're talking about is sort of the privacy protection, those kind of things. But I think it's really important that we don't get hung up on some of the language around ownership, control. The OCAP principles are ones that I hear often that sort of get referenced. The issue with that is that when we start using that type of language and we haven't even defined really what people's involvement in health data and health data governance could or should be, we leave a bunch of people behind in the conversation, right? And so I think those indicators are aspirational. I think that when we talk about using Indigenous health data governance, we need to go back, even further to start again at the relationship piece, the partnership piece. Are we ensuring that everybody at the table feels like they're an equal partner before we start moving into talking about what does good health data governance look like? I think for people who have been working in health research or working, and I'm not, the thing is, I'm not even an expert on health data use and governance, but from an Indigenous perspective, I know what's needed in terms of capacity to be able to start to enter into that conversation and to feel like you can assert, some level of confidence around what ownership means to you, what control means to you, like as an Indigenous person or an Indigenous community, what access would look like, all of those things. And so I think the indicators from the toolkit are aspirational, but they should be sort of taken as examples when you enter into conversation with community about what their expectations are. And I think it was Chanel pointed out early on that we may not even be collecting the right information, or they may want to use the information in different ways, right? So we really need to define those things alongside of community, and the indicators might end up looking, in principle similar, but the goals might be really different.
Thanks, Kimberly. Chanel, do you have anything to add up to that?
No, but I am
Okay.
reading the questions in the chat, which I'd love to respond to them.
Yep. Yes, so the first question for both of you is, how should Indigenous communities assert their rights to when the data collected, as IDS, when the data collected about them, for example, SIPSN. So how do they assert their rights into how the data is collected, at SIPSN, for example, or that data is sent in from each of the practice-based research and learning networks?
Mm-hmm.
Do you
Well,
have any
I think
ideas about that?
it's a good question. I think one of the things that, early on in the presentation when I talked about UNDRIP and Truth and Reconciliation Commission and those types of things, and any sort of legislative framework that when we talk about sort of a rights-based approach from an Indigenous perspective, to me, sometimes that can be really limiting. It feels like you're sort of inside a box, and that box is really the only things that you can, sort of point to in terms of being involved, right? And what I would really hope to accomplish through opening the dialogue around health data sovereignty is an idea that legislative framework is a platform. We shouldn't have to walk into these situations and assert rights. And I understand, your question, that is the reality in some cases, but we should be really trying to break down that, that approach of, first of all, it being responsibility of Indigenous people or Indigenous communities to assert, that they have a place in this conversation. It's really problematic for me.
My first thought was having a seat on the ethics board. Because I think it's the ethics boards that the gatekeepers to the primary investigators. And it's known, I know when patient advocates, or in this case, community advocates, are on the ethics boards, you actually create efficiency, which benefits primary investigators, but it's also the gatekeeper, such that you could insist on those ethics boards that the PI, we would go back, update the protocol to include this type of toolkit or this type of participation. The other area was funding. Sorry?
Go ahead.
I was just going to say the funding mechanism, but I think the ethics is a little bit easier to navigate the ethics boards.
Yeah, and I don't disagree. The only thing that I would say is that in my experience as an Indigenous person, often when you're in those systems, the systems are already set up, right, to be quite different from in terms of Indigenous values and principles, in the way that we apply for funding, or the way that we develop research protocols, or the way, all of those things. And so I do think, I think it's a great suggestion, Chanel, and I do think those are places to start. But often as Indigenous people working in the system, it can be very challenging.
Thanks, Chanel and Kimberly. So the second question here is, if working for an academic institution, how do you suggest implementing advocating for this toolkit to be established as a standard process instead of just being used in one research department?
Mm-hmm.
Do you want to
Well,
start with that, Kimberly?
sure. I have a couple of ideas. I think if it's something like maybe not the toolkit specifically, but maybe with there we have some policy processes that are used often, in applications. For example, there is a gender-based analysis component. What if you were to have that sort of framework applied where everybody sort of had to answer a component around the data use and the Indigenous sovereignty piece. It could be really useful, to have a framework that researchers had access to, where they had to work through, is this, have you considered, Indigenous data sovereignty components in your data management plan, or, things like that.
Mhm.
Chanel, anything to add?
No, no.
Okay.
I want to respect the time. So
So we
Are we
have
gonna
about 8 minutes. So I'm just going to, we also have a question about where one can find the toolkit. And of course, I think we want the idea here was to have this session first, and then we were going to really share this toolkit widely throughout our network communications channels. So stay tuned. We'll have it in our newsletter, on our website, and stay tuned for that. We'll definitely share this widely so everyone has it. We'll also share it with the various network managers and network staff across the countries, that are embedded across the various practice-based research and learning networks. So stay tuned for that. But I don't know if you, Kimberly and Chanel, had other ideas. And I think that was really touching upon my original question, was really how to embed this, in maybe other ways rather than sharing them simply through comms channels, to figure out other
yeah,
innovative ways potentially.
Yeah. Well, I think the toolkit could be, it would be interesting, for example, to hold more specific sessions or focus groups on sections of the toolkit to get specific feedback about, how things might be changing, or how we might want to be more inclusive, or how we might want to think about, embedding components of the toolkit in the health research process. That would be really helpful to me. I know that, if people get a hold of the toolkit and also can think about ways that we can make it more accessible for communities, or to expand the discussion around involvement of Indigenous communities in health data governance. That would be great.
yeah. I think to mention about the frameworks that are coming up, which I mentioned, the ethics, and then the financials as a policy, which may be a higher hurdle. But what I'm trying to articulate is, where are the decision makers for an investigator to move forward, right? It's money, ethics, and the framework is because it's a way of socializing a framework that, the toolkit provides capacity, and that's what the role of frameworks are.
Mm-hmm.
So nothing necessarily new from what I talked about before. It's a good question, but I don't know much more.
Thanks. Thanks for this fruitful discussion. We have one more question so far. We have about 5 minutes, so we encourage anyone to type in some questions that they have. So the final question so far is, one of the key issues that is a general concern about data is interpretation. There is a notable difference between raw data, scored data, and the meaning of that data in the context. he's 100% on board with ensuring broad access data, but how much training do we need to ensure that interpretation is done properly and no harm comes from this misinterpretation? Kimberly, did you want to start with us?
Sure. I think that goes back to my point about responsibility, and I mean, I think that's a great question. And I think it's really important to think about, what data and how it's shared and the contextual piece as well. But I also think that when we start, with the idea that data can't be shared because it may be misinterpreted, I think we're back to square one, right? In terms of that paternalistic kind of understanding of who should have the data, what kind of data they should have access to, and when, right? I think, this idea that are people ready to have access to their own data is kind of, it's a catch-22 almost. It's going to prevent us from actually moving ahead. And again, right, if you're in a trust relationship and at the level of provider, for example, how do you start making decisions together? What is the information that gets shared and how? And then in systems, and I think this is kind of what Chanel is talking about as well, is everybody needs to be involved in the dialogue, right? And it's not just one organization or whoever has the data making the decisions about when's the right time to share it, and do people have enough knowledge for the information to be shared.
That's a good point, Kimberly. I would, well, my comment is actually not on the data per se, but the results of the research. Why is research under a paywall? You have to pay for that abstract, right? Sometimes it is. Why isn't it that we have whoever contributes that research as participants could get a copy of that publication and a commitment to that, or even preliminary data results? I mean, this is all the work that researchers are doing in order to highlight, like, for their career, let's say, or for the institution. Let's start with that. Let's have a commitment that the results of the research could be provided to the community as well as the individuals. And there's a journey for that, and every step, share that information. I think that would be a good step. Well, it is a good question from the audience in terms of the different types of data.
Thanks. So we don't have any other questions. I just wanted to, first of all, thank Kimberly and Chanel for joining us today. It was a great session. Again, please stay tuned for the distribution of this great toolkit across our network. And please we encourage you to complete the evaluation at the end of this session. It should pop up on your screen. Please also stay tuned for future sessions in the new year. From January until June, we'll have about 6 or 7 different sessions. So we're still in the process of developing them, so stay tuned. And everyone have a great afternoon. Take care. Thanks again to Kimberly and Chanel.
Thank you for facilitating, and Kimberly and everyone.
Bye.
Bye.
Bye-bye, everyone.